welcome to Your Health in Your Hands. I'm Dr. David Ajibade with the Brain and Body Foundation. And this is probably going to be one of the most important episodes I've ever done, and I'll explain in a few minutes. As some of you may know, and most of you probably don't know this, but I was pretty much raised by the Nigerian military. I'm a product of the Nigerian military school. As a boy soldier, I guess, and I finished top of my class academically, and I was third best in military training. And so naturally, I was admitted into the Nigerian Defense Academy, 41st regular course. And after a few months, I left. No, let's not talk about that right now. But I left into medical school and went to University of Ibadan, which was then, and I think it still is, the best medical school in Nigeria. And so why am I saying all this? Because I have a deep-seated love and respect and concern for military personnel who are involved in defending our countries around the world. And many of my mates, my course mates, are soon going to be major generals. As a matter of fact, this probably, by the time you're watching this, some of them have already become major generals. So I want to say, congratulations, guys. We're proud of you. But from what I've seen, I've stayed in touch with many of my classmates and my course mates in the 41st regular course and, of course, in military school. And those of them who have stayed in the Army haven't been unaffected by how shall we put it now, being in the military on the war front, whether mentally or physically. And it's so important that we understand. It's been a passion of mine, and I've of course worked with. Okay, I want to do that again. And it has been a passion of mine to work with the Nigerian military to help military personnel to regain their lives, to improve their mental health and physical health. And of course, I've approached the medical corps. The heads of medical corps in the Air Force and the Navy and the Nigerian Army. So today we're going to be talking with a military personnel from Walter Reed Hospital, and I'll tell you why that's important, who actually works directly with people who have been at the war front or have been involved in warfare or combat training and have maybe had some consequences from that. And she will help to share with us what we need to do, some of the things, the lessons they've learned, and what we can apply probably in Nigeria and other countries in Africa. So we're going to take a short break, but please be sure to invite your friends and family. If you're watching this in the Nigerian military headquarters or defense headquarters, please invite your colleagues to come listen to this show. So we'll see you in a few minutes. God bless. All right, welcome back. We are talking today about the mental and physical health consequences of being engaged in active military warfare. And with me on the show today, I'm going to read her bio, and then we shall start the dance and the engagement. Major Sheikh Bade Alabi is an active duty Army Medical Corps officer and a board certified physiatrist. You're going to know what that means. Skilled in general physical medicine and rehabilitation, brain injury medicine, musculoskeletal medicine, leadership, healthcare leadership, clinical research, and academic medicine. Dr. Bade Alabi was a recipient of the United States Army Health Professions Scholarship upon her acceptance into medical school. Very good. She is a graduate of the University of North Carolina at Chapel Hill School of Medicine. She completed her internship and residency in physical medicine and rehabilitation, otherwise called PM&R, at Walter Reed National Military Medical Center in Bethesda, Maryland, where she served as chief resident. She has received a lot of awards. I'm not going to read them all out, but her resume, I gotta tell you, her resume is super long. So without much ado, Dr. Bade Alabi, Major Dr. Bade Alabi, welcome to the show.
Thank you so much for having me on the show, Dr. David. I appreciate the honor, and pleasure is all mine. Thank you.
You bet. And obviously, people are going to say, well, that name sounds like a Yoruba name. So I guess there is some Nigerian in there somewhere, yes?
Yes, yes, I was born in Nigeria. Both of my parents are from Nigeria, but I was raised in North Carolina since the age of 8.
Welcome back, folks. I am here with Dr. Sheikh Bade Alabi, Major Dr. Sheikh Bade Alabi. And like I've said before, this is so important to me because I'm a military person. I was at heart. I was raised in the Nigerian military school, raised in the Nigerian Defense Academy for the first regular course. Congratulations to you all who have made Major General. God bless. Don't forget your people. And the military is near and dear to my heart, and I want to do what we can to ensure that military people, both during and after deployment and after their service time, remain productive members of society. It's so important. And it's hard to be that if you've had a brain injury or your mental health has been threatened or affected. So that's why what we're talking about with traumatic brain injuries, PTSD, and other mood disorders associated with warfare is so, so important. And that's why I'm so glad we have the doctor on the show today. So Doc, let's start by talking about some of the protocols and the things that you have seen that are effective in your treatment and in recognizing these problems, and what you would like to share with other military personnel around the world.
Yeah, so I think the first thing you mentioned was talking about some of the things that we can do to prevent chronic injuries and brain and mental health from happening in relation to warfare. So preventative measures would be minimizing the length of time that any one service member is deployed. So being in a prolonged deployment setting will certainly predispose anyone, particular service members, to more adverse reactions to the mental health as well as to the brain, or more risk and chances of getting injured. So here,
that's a bit of a challenge. I'm going to jump in and say that's a bit of a challenge because in Nigeria we're being stretched. The forces are being deployed all over the country with insurgents, to the Boko Haram down south with all the bunkering and everything, and then and all kinds of things going on. So that's a bit of a stretch, but keep going.
Yes, so certainly that's something you have to continue, trying to mitigate, but it's important to then also address any potential injuries or issues that have happened once the service member does come off of deployment. And so what we do is make sure that they're receive comprehensive evaluations to discuss those things, disclose those things, and give them downtime, convalescent time, so that they can seek medical attention, seek medical care as needed.
Before they come back, is there anything that can be done in the field to mitigate against this while they are there on deployment? We don't want to have to wait until they come back to their bases before they get receive medical training care. What do you suggest?
Certainly. So during deployment, it's important that there is attention paid to the sleep or rest and work cycle. So leaders within the force must pay attention to work rest cycle, making sure that people have some downtime to rest and recover, especially after having a very difficult, challenging mission. And while there, also it's important to recognize the signs of mental health struggles or cognitive challenges in any particular service member. Because once again, as I mentioned before, these things will mitigate or will undermine the effectiveness of that service member and the safety of their comrades in battle. So being able to think clearly and precisely is very important on the battlefield. So if you notice someone that is struggling with, anger or, either depressive moods or hopelessness, those are signs, those are immediate red flags that possibly that person is maybe struggling with depression anxiety or any kind of suicidal ideations, and those should be immediately addressed.
Or they're
Or
drinking a
going
lot, or they're drinking a lot, or
So yeah,
having
excessive
drugs.
alcohol use, yes, erratic behavior. So noticing a personality change, someone who's normally calm is now very angry and volatile, behaving differently or more blunted of an affect,
Right.
blunted affect. Those are things that leaders should look out for and try to intervene.
And I think you mentioned something too that I think is very, very good. Providing, and we're going to talk about some of the nutrients that you use at the main hospital, but actually talking about providing some of these, having them available there so that if people recognize these problems are beginning to happen, that they can start actually using the nutrients. They're not medications, but they're nutrients to probably help to fortify their brains or improve their mental health there and then in the field. What do you think about that?
And that's a great idea. I would even argue that it's better to have it as part of the deployment package. So when you're being deployed, we know you have to update your equipment, make sure that you have the right tools, uniform, and so on and so forth for the mission. However, we often neglect the things that we need to arm our body with in order to endure the stress of combat and endure and prevent adverse or chronic effects of that exposure.
All right. So what nutrients what would those be? We definitely want to have those. So
Yeah.
what should be part of your kit, in other words?
So in terms of brain health, it has been proven that omega-3 fatty acids are very vital in maintaining the integrity of the brain and the neurons. And so nerves and neurons need omega-3 in order to function properly. So making sure that we supplement soldiers with that, just once daily, 1,000 milligram fish oil supplement will go a long way. So that when, in fact, an injury occurs, if we say it again, 23% of service members experience TBI or concussion, they are able to recover a lot quicker and faster.
Mm-hmm. Okay, so omega-3, it's what else? I would throw in zinc, and I would throw in magnesium as well, because you mentioned magnesium, and I was impressed with how you use it at the hospital and the effects you get from it. Do you want to say a quick thing about magnesium as well?
So magnesium has been proven, especially as a treatment for migraines. We know, again, like I mentioned, concussion, one of the most common side effect or most common symptom or complaint is migraine headaches. And magnesium has been proven to be efficacious in treating migraine headaches. One of the main reasons it helps is that it limits or mitigates the inflammation that comes from insults or injuries to the brain and the head. So using it prophylactically, even before an injury occurs, will help patients or service members to recover more quickly or faster, more effectively, more efficiently after an injury. It does a lot throughout the body in terms of maintaining sleep, overall wellness, mitigating anxiety, stabilizing the neurons and the nerves and the muscles so that you can continue to be at your optimal when you're in the environment, in the service environment.
Awesome. That's great. So omega-3s, magnesium, like I said, I mentioned zinc, vitamin D, especially for we Black people. You know,
Yes,
I'm always talking about
vitamin
vitamin D.
Very
For
important.
everybody.
Yes.
And then vitamin C, because vitamin C helps to repair. I mean, it's important for repair of pretty much every tissue in the body, right?
Yes,
Vitamin C.
yes, agreed.
All right. So anything else you think you should be added to this? I've mentioned 5 now.
What's that?
I mentioned 5. Anything else you can think of, or that you guys use over there?
Well, this is not necessarily a policy right now, but is a recommendation that I would like to propose, that we should be more preventative and less reactionary. There's still a lot to be found out in this arena of brain and mental health, and so. But these are the things that are being shown to help after injury. And I would like to propose that it's best to begin before an injury so that the body can recover and you have less morbidity, less chronic health. The burden of these injuries on the healthcare system, the military healthcare system, is quite high. So what we can do to mitigate that will be highly effective. And these are very simple solutions. They're not drugs, they're supplements, and they're relatively cheap.
Absolutely, and that all that works for people in third world countries as well, especially for those of us in third world countries where we don't have access to all the super duper MRIs, fMRIs, CT scans, and all the things that are so readily available over there. And of course, the ability to monitor drug levels, blood levels of different things. So, but these things that you've mentioned, I think, are, like you said, safe and they're relatively cheap. So that's great. All right. So in the few minutes we have left, what happens when they come to you at the hospital? I know you mentioned a few things like sleep, making sure that their sleep hygiene is improved upon. We've mentioned medication, we've mentioned good supplementation. Anything else you do in terms of maybe exercise, or what else do you do for them? Because you mentioned a whole comprehensive approach to this.
Yeah, so this requires, so TBI is a multi-system injury. It affects everything from mood to your physical, health in terms of chronic pain. So those who've had TBI are more likely to have chronic pain, either neck, low back. So we have to address all those things. So if you are suffering from chronic pain, your ability to recover and to actually rehab the cognitive, the mental aspect is going to be very impaired, right? So if you're preoccupied by your pain, you cannot really focus on your rehab for your cognition. So we have to address their pain through medications as well as through therapy. So physical therapy often helps. Yoga, mindfulness are all things that we use to mitigate pain, as well as treating the sleep. So sleep is important for just about everything. Your brain is able to repair, your body repairs itself during sleep. So if you're not getting adequate sleep, there's nothing that we can do with medication or treatment that will actually have any long-lasting effect. Sleep is very critical, and it's something that you have no control over. It's very automatic, but there are things that you can do to make sure that you have more of an improved quality of sleep so that your body is given the right tools to repair itself.
Such as making sure that you sleep in a dark room, or at least covering your eyes, no noise, no cell phone.
Yes, so staying off your cell phone within the 1 or 2 hours before sleep, minimizing blue light exposure, again, from all of the devices, your laptops, things like that, making sure that your room is nice and dark and cool, at least 68 degrees is what's recommended. I mean, it's not always possible, but you can certainly try. Doing things that help with relaxation, winding down, such as just doing your stretches, breathing exercises to calm the mind, calm the body, taking supplementation such as melatonin and magnesium is very helpful in getting more, falling asleep easier and staying asleep. And you want to make sure that you're getting at least 6 to 8 hours of sleep a night. Not always possible, but we can
that's not gonna happen.
But if you're not able to get an amount of sleep, what's more important is actually the quality of sleep. So right. Wearing these like devices, wearable devices like Fitbits and smartwatches help to tell you, if you wear it at night to sleep, you can see what type of sleep you're getting. And so then you can have, figure out what tools to use to improve your sleep. Again, much of this is dependent on your autonomic nervous system, which you don't have any control over. But things that help to regulate your autonomic nervous system to make it more effective are breathing and relaxation by far. Medications do not help. Breathing, relaxation activates your autonomic nervous system and allows you to fall into a deeper sleep.
Fantastic, fantastic. So much to learn, so much to know. And I, as you folks, as you know, I can very much relate to what she's saying, especially when it comes to supplementation, because we've used these very same supplements that she's talking about over and over and over again under the supervision of the federal government of Nigeria, by the way, on severely brain injured children, and we've seen significant improvements. So if it works in kids, you can be sure it's going to work and be safe in adults as well. So again, if you work with the military or in the military medical corps, please take this to your bosses at the top, your guards at the top. These are things that should be part of our strategy. Again, these are not protocols that she's just suggesting. She has seen that the doctor has seen that these are things that have worked when they've worked with patients, both on the fields and in the hospital. So it's very, very important that you consider using supplementation. Doc, well, this is great. Now, let me ask you this.
I just want to clarify for a second that even though they're not necessarily protocols, these are clinical practice guidelines is addressing sleep, chronic pain, addressing the mental and behavioral health of the soldier, and having more of a comprehensive, holistic approach is definitely been studied, and it's a clinical practice guideline recommendation.
Fantastic. Thank you for clarifying that. So one more question. Once you apply these things, how likely is it that the soldiers get full recovery?
So that depends on the soldier. It depends on the severity of their injury and the chronicity of the injury. So if you've been struggling with something for over a decade, you're likely going to need anywhere from 6 to 12 months of treatment and therapies, interventions to start getting better. And even then, we cannot necessarily guarantee that there will be full 100% recovery, but there will be optimal, or there will be beneficial recovery to the point that you are able to be a better and productive member of society by having the right tools. By far, the most that we offer our patients is education. The education of understanding what it is that your body has gone through, why you're feeling the way you feel, and arming you with resources and tools and education of how to deal with those things, so that we are empowering our patients and not necessarily, we don't do the healing, we don't do the actual process. We're giving you the tools and creating the environment so that your body can do the healing and yourself.
Absolutely, absolutely. And that is education. Knowledge is power. Education is also important for the families as well. So even the spouses can understand, get an inkling or insight into why their spouse is behaving the way they do. And
yes, very important. Yeah.
You'll have more consideration and sympathy for them rather than reacting to the way they are reacting, right?
Yes, our programs actually incorporate the family. We do family therapy so that the spouses are brought in, they're educated as to why they're seeing what they're seeing. And so the better they understand, the better they can come alongside the service member to support their recovery and their healing. We do family therapy in terms of helping with marriages, because again, communication, if you're struggling with memory and you're struggling with all these other things, being able to communicate in a very effective way with your spouse is going to be limited. And so we have to help with those, to provide those tools, because your family is all you have at the end of the day to help you through these problems. And so anything we can do to preserve those relationships will be helpful.
Absolutely. That's so fantastic. Thank you for what you do. Thank you for this information. I think it's going to be of benefit to so many people. Well, folks, this ends it. Thank you for listening and joining us on this program. Dr. Shea, Major Dr. Shea Bade Alabi, and that's a mouthful, for a very, very smart and
also known as Dr. G. Yes.
Also known as Dr. G. That's a lot easier. Why did you tell me that before?
I did.
Just kidding. Just kidding. Thank you so much for your time.
Thank you for having me. It's been a pleasure.
All right, folks, take care, and we will see you next week. God bless. Bye.